What effect could these proceedings have on public health in the US? Dr. Owais Durrani is an emergency medicine physician and medical analyst in Houston, Texas. Great to see you. Just tell us, what are your thoughts, firstly, on Dr. Fauci being held in contempt of Congress?
Yeah, my initial thought would be I think it's a sad day for public health in America. I think to the young, person who maybe is going to medical school or wanting to get a PhD, or maybe they're in that process, and maybe they want to go down that route of public service like Dr. Fauci did. And this is the example for them, right? They may make it through all those steps, be able to meet those challenges and do the best that they can in that moment, which is what all of us do in healthcare. And then one day they may be kind of brought in front of the US Senate and held in contempt and, threatened with jail time, which is terrifying. And so that's where my mind kind of goes to first, for a man that, has dedicated his life to public service, who helped us fight so many battles, including the AIDS crisis in the 80s, and obviously this once in a generation pandemic. And it just unfortunately sets a bad example for those that we are trying to recruit into this very tough field.
Owais, we spoke to a political scientist here last week, and I'm going to summarise basically what he said. And he said basically that this did appear to be political point scoring in some form, these proceedings in Washington, but also that the wounds and the grievances from COVID hadn't really healed in the US, and that it was appropriate, in his view, to revisit decisions that were in some instances heavy-handed and did unnecessarily restrict people's freedoms. What's your response to that?
Yeah, I would agree, right? In the scientific process and in medicine and in science, we always, look for what we did and was it right? Was it not right? Did what the actions we took, were the answers to those actions what we expected? And if they weren't, then we kind of analyze that and correct for future experiments, or in this case, a future pandemic. I agree that we haven't healed from the pandemic. There's a lot of mistrust within healthcare that has increased over the last few years. Unfortunately, things like, vaccine hesitancy or violence against healthcare workers, those things are on the rise. So obviously there is something that we have to deal with, and we have to deal with it because there's going to be another pandemic or another crisis where we're all going to have to come together. But how we deal with it is obviously in a bipartisan way, in an objective way, where we can learn from those things and then take those lessons and hopefully do better next time, rather than trying to assign all of the blame on a person or a set of people, just for, like you mentioned, that political scientist said, political points.
But Republicans would argue that they have a right to scrutinise the decisions that were made, and particularly the people that made them, and that's what they're doing in these proceedings.
Yeah, no, they do have that right. We all have that right. I'll give you an example, right? In healthcare, in the hospital, when a unexpected death happens or an unexpected outcome, we have what we call morbidity and mortality conference. It's where all the clinicians involved in that patient's care, the nurses, admin, all sit down, and no one gets punished. Everyone kind of gives their perspective of what happened, why they maybe gave a certain medication or did a certain procedure, and then there's a discussion around, hey, maybe that shouldn't have been done. Maybe it should have been done a different way. Everyone leaves there learning something, and once again, no one's punished. You don't get a strike against you or anything like that. That's what we need to do here, where we have a conversation. Was everything done perfectly? No, but it wasn't done perfectly in any country. This was once again a once in a generation type situation, and so mistakes were made. We need to learn from those mistakes, but we have to do it in a way where that discussion happens, rather than something that's a made for TV event.
Right. Now, I would just like to gauge from your point of view what the pandemic has done to trust broadly in public health in the United States.
Yeah, so broadly, if you look at the polls that are done every year in terms of, what's the most trusted profession and your level of trust in healthcare, those numbers have come down. They're still, in a place where, healthcare still is a trusted profession, but they've come down over the last 6 years. That in turn leads to other downstream effects, right? It may lead to people not coming for their yearly physical and missing diagnoses that could have been caught earlier. It leads to things like, vaccine hesitancy, where measles is is at a multi-decade high. It leads to things like violence against healthcare workers, because some people believe that maybe we don't have their best interest. And when, someone is in the ER, maybe interacting with a healthcare worker for the first time in a few years, and you say something in terms of a treatment plan or whatnot, they don't like it, and things unfortunately go south. And so it is a problem I see on a daily basis. And then on a broader picture, it's something where when you go to a healthcare conference, my colleagues talk about this frequently as well. And so it definitely is a problem, and we have to figure out how to fix it, because, when that trust goes down, it harms all of us, unfortunately.
And on top of that, the pandemic also saw a huge amount of misinformation being spread around. Has anything changed since then?
It's gone worse. There's a frequently cited number where, if you share something that is misinformation or bad information, it spreads 6 times more quicker than the truth and facts. And we see that every day, right? We see it, once again, I keep bringing up vaccines, but that's something that we're dealing with on a day-to-day basis here. But we see it where people try fad diets, where maybe they don't want to take a certain medication for, say, diabetes. This is something I saw personally, where they wanted to, take advice of a TikTok influencers, and unfortunately they showed up in a very decompensated state, had to go to the ICU. And so we see the results of that misinformation spreading on the ground very rapidly. And that trust factor does come in, right? If you don't trust the healthcare system and your doctor, you're going to turn that attention and that belief to somewhere else. And unfortunately, that has been social media in a lot of cases, and people believing things. And there's multiple things, right? AI is kind of speeding it up as well. There's AI fake influencer physicians that you can't tell if they're a real physician or a AI version of one that people take advice from. And it's unfortunately all just adding the fuel to the fire that we have right now.
And what are some of the solutions to this, to counter this misinformation that you've just outlined?
Yeah, so the solution to drowning out the bad information is to get more good information out there. And it's a hard answer, right? The easy thing to say is, hey, clinicians need to be on social media. They need to be where people exist. The downside to that is I create a lot of social media public health content, but then I will get personally attacked. I get DMs that are not so pleasant and whatnot. And, I have a thick skin, but, people may not want to deal with that. And I don't blame them. I think we need to get to a place where healthcare and science, once again, is a nonpartisan issue where, it's built to help everyone, not to get anyone. And we need to find that consensus. I wish I had the exact answer to that, because it is going to be a tall order to get back to that place, but we have to. There's no other option.
What are some of the lessons that the world, and particularly in this instance America, need to learn to respond to the next health crisis, the next pandemic when it comes along?
Yeah, we have to make it nonpartisan, right? You look at, for example, a country like the United Kingdom, where they had a review of their COVID protocols and what they did done through a nonpartisan judiciary process. They put out reports. We need something where, when the next event does happen, it's not something that's, one physician or one head of the CDC, making that decision and all the blame and everything being placed on that person, but a nonpartisan way to communicate that information, which was done, in my opinion. But unfortunately, that became politicized. Dr. Fauci obviously served under both President Trump and President Biden. So he was someone who was not partisan, working with both sides of the aisles, trying to get good scientific information out there. But I think we have to hold our leaders to account as well. Those leaders that, try to politicize healthcare for reasons that, are unfounded, they need to be called out on that as well.
Great speaking with you. That's emergency medicine physician Owais Durrani in Houston, Texas. Thank you so much.